welcome back to another episode of the Startup Junkies Podcast. Full disclosure, this feels kind of weird. You can't see us, but we're in person right now for the first time since March. I think it was March or February of 2020. This is Caleb Tally, Director of Marketing and Events with Startup Junkie Foundation, with my co-host, Jeff Amerine.
Yeah, Caleb, I'm glad to be here, but I'm still not really sure we're not just holographic projections. I think this may all be a simulation.
I agree. I think there's, either
really
we are
sure
or we
how to
aren't, so
react
it's a 50% chance.
Anything at this point.
50% chance that we are a simulation. Well, we are pumped to have for our first in-person guests of the new year, this new post-COVID-ish era, the gang from Lineus Medical. We have Vance and Spencer with us. Welcome.
Thank you. Pleasure to be here.
Thanks for having us here. We're excited too.
And absolutely excited to have y'all. So obviously we're on the heels of some pretty big news at Lineus Medical. Y'all want to tell everybody out in the podcast sphere what that big news is?
100,000 listeners in 100 countries.
Yeah. So we, at the end of May, so just about 2 weeks ago, got word from the FDA that we had finally received Fda Clearance on Safebreak Vascular, our flagship device. So that was thrilling. It's been a long time in the making. We've been going through the regulatory process for roughly 3 years now. Founded the company 6 years and 1 month ago about. So a lot of hard work went into getting to this point. And, we're just really thankful to all the investors and collaborators and, people like Startup Junkie and that have supported us along the way. But it's definitely a huge milestone, really the biggest milestone in any device, company's kind of path usually. So we're just thrilled and excited.
Well, talk a little bit about why that's so meaningful as a medical device company. What can happen next now that you have the clearance? Not all of our listeners are going to be schooled on regulatory processes. So why is that such an important benchmark?
Yeah, it's a great question. A lot of people, have some misconceptions about what FDA clearance really means. And so, some people would ask me, oh, does this mean you can make it now? And I'd say, no, we've got a lot made, ready to go, ready to sell. So really, what the FDA clearance means is that we're now able to market and sell the device in the United States. And, what goes along with that marketing is, you can market it for a very, specific use, what's called your intended use, right? And that's what kind of some of the negotiation with the FDA is around. So, we, once we got that clearance, that's, we're able to market and sell. The FDA is pretty restrictive on being able to pre-sell right before you have clearance. So people always say, oh, you have a bunch of purchase orders lined up and, people, and it's like, you really can't do that, right? You have to wait on that clearance before you can start really getting commitments. Of course, you can, build relationships and things like that, but it has to be pretty, you have to be pretty aware and pretty cognizant of those restrictions.
And so for those who are listening that, might not be familiar with Lineus or y'all have been on the podcast before?
Some time ago. Yes. Pre-COVID. Yes.
So of course, go back and listen to that one too. But for those who haven't listened to that one, tell us about Lineus and, where Lineus came from and just kind of that beginning of that journey.
Sure. So Spencer was working on the night shift at a hospital in Little Rock, and he just saw these problems with IVs firsthand, and he decided there's got to be a better way to deal with peripheral IV failure than currently existed. And he started thinking about it and had the idea of some type of breakaway connector that would be added to an IV line that when a damaging force was placed on the line, it would break into two pieces and offload that damaging force and protect the IV, keep it intact. So for lay people, it's just like at the gas station. If you leave your gas pump handle in the car and you're talking on your cell phone and you forget that you had not put it back on the gas pump, you get in your car and you drive off, there is a breakaway connector on the gas pump that shuts off the flow of gasoline and keeps the parking lot from, filling up with gas. And they can come back to the gas station and give them their handle back and they can reconnect it, right? So it's just the exact same idea, except doing it for humans. And Spencer was able to, there was already a patent on a breakaway connector, and he was able to acquire that and enter into a business accelerator in 2015 in Memphis that specializes in medical devices called 0 to 510 for anybody that's interested. And when he graduated from that program, he started raising his seed funding round. And Startup Junkie was hosting a a seed investor meeting, in the bottom of the OPO across the street from us here. And I had been meeting with Jeff and telling him I was ready for something different and had some money to invest and so forth. And he said, you need to meet Spencer Jones. So I attended that session, and that's how Spencer and I met. And I started working part-time for Spencer to do my own due diligence on the company and figure out if it was going to be a good investment. And we didn't know each other from Adam, right? So it was a opportunity to get to know each other's work ethic, right, before you jump into a startup together. And all that worked out great. And so my wife and I invested, and I came on board, and the rest is history. It took 5 years to, after that to get to our goal of FDA clearance in the end.
And some of that, they, as I recall, I mean, I know you're glad and you've gotten good reviews and good approvals recently, but some of it was they changed you from being able to use a predicate, which would have been ostensibly a quicker device, to being de novo, right? You had to do there was a little more rigor involved in the process.
Yeah, that's absolutely right. So the 510K process is the regulatory pathway that most companies go through with the FDA. And it's basically just, hey, there's another market on the device. We're going to be kind of a me too. We're going to be just a slightly different version of their device. And so the regulatory pathway is a lot more simple. You basically just recreate and redo all of the testing that your predicate device did. And it's designed to be a much more swift process through the FDA. But kind of in the midst of our 510K review, they came back and said, we think you're more unique than your predicates, which honestly, there's not a device that, goes in the IV line and intentionally separates. But there are some devices that have, flow control components and things like that. So, I'd say it was not great news when we got the word that they were kicking us de novo, but there were a lot of benefits to it. Some benefits, some drawbacks. Main drawback being it just takes longer, and typically for de novo devices, they require a good amount of clinical trial data. So obviously having to do a clinical trial in the middle of a pandemic was incredibly difficult and time consuming. But I think the main part with the de novo pathway is you're really creating a new class of device, right? This class of device, this type of device does not exist. And so you get to create your own special controls is what they're called. So special controls are just specific types of testing that your type of device has to complete and pass for the FDA to give you clearance. So we put forth some very rigorous special controls that we passed. And so that's just going to make it harder for anyone that comes behind us. It's going to make it harder for them to get that clearance. But, devices that come after us, they will be able to 510K off of Safebreak as their predicate, right? It's one of those things where, if we would have known that we were going to be kicked 510K, maybe would we have done things differently? Sure. But we're really happy with the indications for use that we got. The clinical trial data that the FDA requested ended up being phenomenal. So we're launching now with great clinical trial results. And so, it worked out how it's supposed to, I guess, at the end of the day. So, it's definitely a long process. And for anyone that's interested, the new class is now called force-activated separation devices. So that's kind of the broad moniker that the FDA tagged. Our device still called Safebreak Vascular, but that's the general class name.
Gotcha. And now that you've got the approval, how's the reception in the market so far? Are you getting a lot of interest?
We're only about 10 days post-clearance. I think the interesting experience was we had a lot of, we were almost out of money, literally, really close to being out of money. And we had a funding round with commitments, a significant funding round with fully committed if we got FDA clearance. So we were, as startups do, trying to balance things on a knife's edge. And so we were waiting to get clearance, and then we would have lots of money. And if we did not get clearance, we would have zero money. We would be in debt. So that came through, and I will just say our first 10 days has been our bank account went from almost zero to over $1 million in the bank account in 3 days. So that's really exciting. And now that finances are not an issue, the effort for us as a company is we have 2 distributors signed up currently. We believe that we'll end up with somewhere around 5 to 6 total. So most of the distributors don't want to, we've reached out to many and have spoken with many, but they don't want to negotiate a deal until you have clearance. They don't want to waste their time on products that are not cleared by the Food and Drug Administration. So that's the next effort, mainly is to get the sales force up. And we're, Spencer's going to be training the 2 groups of distributors we have now. And so I believe we'll have our first order in just a couple of weeks from the hospital where we've done our clinical study, that they're believers and investors in the company after the clinical study.
That's great.
So that's the best, right? You get a strategic investor, has used the product, and we'll have an instant referral for anybody else that's trying the product second, third, fourth hospital down the line.
We'll talk a little bit about the product. Is it one of those things that's kind of a consumable item, or what's the life of a typical product in terms of things like repurchase? I think that some of that's kind of an interesting aspect of what you do.
Yeah, so we would consider this an infusion disposable. It's not designed to be reusable, right? So once it separates, it physically can't be put back together. That's largely for infection risk and sterility purposes. But hospital stocks it on the shelf. And I say on the shelf, they put it in the supply Pyxis rooms, right? So nurse logs in with their credentials, pulls Safebreak whenever they're starting an IV, right, or they're replacing a Safebreak, and they use it on the patient. It's good for up to 7 days, or according to your hospital's IV tubing change policy, right? Some hospitals change the tubing 3 to 4 days. Some have different policies, but we, no longer than 7 days. And then, really, if it doesn't separate, the patient's not really even going to notice it's there. The nurse just treats it almost like the tip of the IV tubing, right, from the pump. But when it separates, it's going to seal off both sides, alert that pump. Nurse comes in, takes just a couple of minutes to, remove the old Safebreak, put on the new Safebreak, and restart the infusion. So pretty short life cycle as far as the actual use of each device. That's the name of the game with disposables. So consumables. Yeah.
We're a medical device company, so we like to sell more product, right? So every time the device separates, we get to sell one more Safebreak. So.
Gotcha.
Yeah. And just to kind of piggyback on something Vance mentioned, the Hartford relationship was really developed through a business accelerator, Digital Health Connecticut. So just kind of wanted to give them a shout out. That was I think that started in the end of 2019. Yeah. The kind of the Q4 of 2019. And as you can imagine, it's a digital health accelerator. There's nothing digital about Safebreak, but one of the people on the review committee, who was the principal investigator ended up being the principal investigator for our study, Lee Steer, said, guys, I know this isn't digital, but this thing is really great. I think this is a winner. And so we were able to go through that accelerator, develop the relationship with Lee, with the hospital, with the executive team, kind of parlayed that into a clinical study there, and then, continued the relationship once they saw the results from the study, and ended up, as Vance mentioned, getting an investment from their hospital corporation. So,
as part of your overall strategy for development, you've participated in more than one accelerator over time. Talk about how that has been helpful and what you picked up from each one of those along the way.
Yeah, I'll start, and I want Vance to chime in on this too. But really, accelerators. I'd say without accelerators, I don't know that I would have ever been able to start this company the way that I did. I was a nurse working the night shift, and didn't have a bunch of debt, but didn't have a lot of cash on hand, right? And the ARC Challenge down in Little Rock was the first accelerator I participated in. Gave me some seed capital. I ended up winning that competition, which gave me the capital to then, as Vance mentioned, to go out and purchase the patent. That really was the foundation of Safebreak, right? That led to the Memphis Accelerator, which was, I always say it was like getting an MBA in med device, that 13-week program. And, from there, I think we participated in, we did Digital Health Connecticut, the Korean Startup Challenge was there.
That was second, yes.
Yeah, and then Project Healthcare is one that we're technically still in right now, out of Nashville, which, shout out to the Nashville Entrepreneur Center. They're great. But I think, accelerators are time consuming, right? They are. But if you make sure that it's a good accelerator and it has good direction and good program managers and directors, et cetera, it can be really valuable, helping you grow, helping you learn, but then helping you expand your network in areas where you may not have a lot of contacts, for instance, for us in Connecticut. And I'd say, especially for a device company, we got a long life cycle till we get to clearance, right? It took us, 6 years from company founding. So accelerators for us, I believe they were a great way for us to continue to generate momentum, continue to generate traction, however we could define it at that time, right? And kind of help us keep moving forward and progress, and not be stagnant, right? People are looking in and they're saying, okay, they're doing this, they've been selected for this, right?
Yeah. I think each accelerator offers something different for where you are. And as an entrepreneur, you need to evaluate what each one brings, what they specialize in, what they bring to you. Spencer, being a nurse, the first accelerator he joined went to the very, very beginning, business plans, legal work, accounting, all the basics of business that you need to think about. So if that's where you are as an entrepreneur, then you need to seek out an accelerator that provides that kind of stuff. And then he exited and he was ready to raise his seed funding round. So that was great. We applied for the second accelerator I almost on a whim. It was in Korea, and it was the largest accelerator in the world is what they build themselves. And they had over 1,500 applicants, and they take 80 teams, and they pay for you to be in the accelerator, which is odd. And they don't take any equity, and it's in Seoul, Korea. So why would this Arkansas company do that? Well, we knew a guy from Fayetteville that spoke Korean and was living with his grandparents in Korea at the time. And we decided, well, if they pay for it and we could learn a lot from it, so let's do it. So that's what happened. We got in. We were one of the 80 teams selected, and we employed that person that was in Korea that was originally from Fayetteville, Arkansas. He spoke Korean fluently. So we did really well in that accelerator, right? We had a team member that spoke Korean. And in the end, out of those 80 teams, we finished fourth out of 80 teams, starting with almost 1,500 teams. And that paid only $6,000 to win fourth place. But the other three companies that were in front of us were all generating revenue already. They already had sales, and we were not cleared with Safebreak in Korea. We couldn't sell anything. So again, like Spencer said, that gave us tremendous momentum. People are like, sure, wow, you finished the world's largest accelerator and came in fourth place. But I will say the third one we went to, we knew what we wanted. We knew what we wanted to do. And Digital Health Connecticut was it. Big hospital system, 7 hospitals, a lot of hospital beds represented. That was a hospital system that had a venture capital arm that was looking for successful companies to put venture capital into. They happened to have a vascular access key opinion leader in the world of medical devices that was there. And so, just as Spencer said, I think what we really did well there was during the interview process, they asked what we wanted, and we knew what we wanted. We said, we're looking to come here and do a clinical study. We're looking for a hospital that wants to invest in us and become a strategic investor, and so on and so forth. We had our 3 things that we wanted to accomplish. And it has taken 18 to 20 months, but we've accomplished all 3 of those things. And the last one that we entered was Project Healthcare in Nashville. And it's sponsored by HCA and 2 other healthcare corporations, the largest healthcare corporations in the world that own hundreds of hospitals. So, of course, that's one we want to be in, and they could introduce us into those chains that if we get one trial that goes well at one HCA hospital, it opens up 100 more
giant
HCA
network.
hospitals, right? Giant network. So that's why we did Project Healthcare in Nashville. So we've been strategic about picking them. But the other thing I will say is that we've been very dedicated. We went to Connecticut every week. We had somebody there every week. We worked them. We worked hard. We worked on our company hard. We worked on the accelerators hard, and it has paid off every time for us.
It wasn't accelerator tourism. Occasionally we talk about professional accelerator attendees who are all about the lifestyle and never really do a whole lot. They're maybe good at telling a story. But you all were strategic about picking out the pieces you need along the way, which I think is instructive.
No, we definitely were. And we actually were cognizant of that kind of persona that some companies have. And I've seen them, they just float from accelerator to accelerator, getting enough money to keep going, et cetera. And so, we were strategic, we were selective, but, when we accepted one, we fully committed. And I think that's kind of just part of our culture of if we're going to do something, we're going to do it the right way. But the executive team, the program directors, everyone saw what we were putting into it and how engaged we were, meeting deadlines, showing up to meetings, following up with mentors and connections and introductions. And so, accelerators are very much, you get out of it what you put into it. And, like I said, they take a lot of time. We don't have a lot of time to spare. So if we were going to do it, we wanted to make sure that we, did it in a full-throated fashion.
And these later accelerators are taking later stage companies. They're not helping you with logo and accounting, right?
Sure.
They're taking people that already have prototypes and are ready to do a clinical study and those kinds of things. So like I said, there's different kinds, and you need to research and figure out where you fit.
You bet. So you've gotten through, product one is through this hurdle. Talk about what the next 3 to 5 years looks like. Are you rolling out product 2, 3, and 4 behind this? What does that look like for the company?
So I'm an avid Startup Junkies podcast listener, and as you say, Jeff, all the time, that when you take venture capital money, you're getting on a treadmill.
You're on their treadmill, the
treadmill, and that's the example I use all the time. And if you have this super big valuation and you take super big money, then the treadmill's running faster than if you have a reasonable company valuation and you take a reasonable amount of money. So I prefer to jog on the, or walk fast on the treadmill as opposed to be running and out of breath the entire time. So we do have 4 significant venture capital companies that have now invested in us. And we've just been very clear the whole way that our goal is to get sales up to a significant level. And as the venture capital companies won in a reasonable amount of time, in the medical device space, people pay for companies based on a multiple of revenue. And so it could be anywhere from 3 to 6 times revenue. So that's the number that we're pegging, in the future. So we have a goal number of what we want to hit, and our investors know that number, and they know when we get there that that's a big win for everybody. So we're on that treadmill, and the company is to be sold, at some time in the future is the bottom line.
Right. When you're on that treadmill, the exit is typically some kind of liquidity event, not a public offering, but an acquisition in your space. Is it other people that have related devices that are acquired? Is it private equity? Who are the typical acquirers in the space that you're in?
There are definitely situations where private equity comes in, and takes a controlling interest. But I'd say for the vast majority, there's a lot of M&A activity from the big companies. Becton Dickinson, Bard, Teleflex,
Baxter Healthcare. There's a good kind of number of 800-pound gorillas that gobble up these, usually it's a 1 or 2 product companies, right? And then roll it into their portfolio with their adjacent products. So that's pretty typical of the life cycle. And, we do have a secondary product. It's right in that vascular access wheelhouse though. So, we're anticipating that if someone wants to buy us, primarily for Safebreak, they'd also be interested in acquiring the other product. But there's also the option on the table that maybe they're not as interested in it, and we could continue moving forward with Lineus and that secondary product, and kind of just run the same script again. But acquisition, there's a number of companies that usually have a pretty high M&A activity that we have on our radar and think that would be the most likely outcome.
Gotcha. Mm-hmm. Caleb, take the helm. I've been beating these guys up too much.
Well, I'm just here to contribute my good looks. That's why I didn't have a recording
and
this
the
time.
awesome Arkansas baseball shirt.
So represent and go Hogs.
Are you interested in partnering with the Startup Junkies podcast? With more than 100,000 downloads across 100 countries, the Startup Junkies podcast is quickly becoming a go-to source for impactful entrepreneurial stories, advice, and more. Visit startupjunkie.org/podcast for more information on all the sponsorship opportunities available. We look forward to working with you.
I'm going to take it back a little further on the timeline, because I like to imagine our listeners are in a wide range of entrepreneurs, different places in their timeline. Spencer, I'd be curious to have you talk on going back in time, that period when you were deciding to go from being, a nurse and developing this idea and this concept to taking that leap to, okay, I've got to quit my day job or night job, whatever it was, and go full throttle, and what that decision process was like.
Yeah. So the very first, I'd say I was working as a nurse. I had just moved to Little Rock, and kind of while I was making that move, I, had this idea, was working on it. I used to work at Walker Brothers, and so John Cole, who teaches business there, he said, put a business plan together, and I said, okay, and then. I think he linked me up with you, Jeff, and I, drove down to. I was still up in Fayetteville at the time, drove down to Little Rock, had an Innovate Arkansas meeting. I think I had 2 meetings, and those went well. And you guys suggested, hey, why don't you apply to the ARC Challenge? So I was at that point when I was accepted to the ARC Challenge, was living in Little Rock, working full-time night shift as a registered nurse, and I didn't jump ship yet. I was working night shift. Most of the program activities for the accelerator were during the day, so I was just kind of balancing that and trying to find sleep where I could. And then finished that accelerator. And when there was 8 teams that competed, and I was lucky enough to win that accelerator. And from that point, I was like, okay, that was $20K initial funding and then $150K for winning it. At that point, I was like, okay, this is real. This is, this is an absolute career path opportunity for me, but I still was not ready to jump ship yet. And frankly, because the money kind of immediately was, went to product development and then went to eventually purchasing Safebreak, the patent for that. But, so I wasn't kind of paying myself in a traditional sense. And then, that was November of 2014. Early 2015, purchased the Safebreak patent, applied to 0 to 510 in Memphis. And that kind of, March to May period is where that decision to fully commit happened. And the Memphis 0 to 510 accelerator was full time. They said, we need you, butt in the seat the whole time, 8 to 5 and longer, et cetera, for the 13 weeks. And so I went to the HR department at St. Vincent in Little Rock, and I said, "Hey, and they were aware. Like, I was fully transparent with them about I had these designs and kind of this the kind of business endeavor going on, and they were very supportive. And I would just recommend to any entrepreneur that's working for another company to just be upfront, because there's obviously some issues if you're trying to hide it. And frankly, if you're upfront the whole time, they'll generally support you, right? They want to see you succeed, and they understand that people try their hand at entrepreneurship, right? That's something that they can understand. So I went to the HR at St. Vincent's. I said, hey, I got accepted this accelerator in Memphis. I love working here. I want to explore this opportunity. Can I take a 3-month leave of absence? And if it doesn't work out, I can come back and continue to work. And they said, absolutely. You'd be stupid not to try this opportunity. So I honestly, that alone was a huge linchpin in them being, willing to help me, or willing to let me go explore that and kind of have that fallback. But that was the point that I jumped ship. Walked out of the hospital April 30th in 2015, and that was the last time I clocked out. And started the accelerator, and we kind of went through the rest. But I always recommend, when you need to quit your day job, it will be obviously apparent. If you're on the fence or you're not sure, then you don't need to quit it yet. Whether it's something like that opportunity that pulls you away, or it's financial, like you're making revenue or whatever, you'll know when you need to quit. Entrepreneurship's risky, but it doesn't have to be riskier than it needs to be. So I always say it'll become painfully obvious when it's time to leave your current employer for your entrepreneurial endeavor.
And I think that just is, that speaks to the fact that, early on, it's obviously a grind. And so working that day job or night job and then, splitting time contributes to that grind. And just, it's not for the faint of heart, as we've learned from experience.
My hairdresser, I remember while all of this was going, while I was living in Memphis and I was getting my hair cut, and she was like, your hair's kind of falling out a little bit. And she was like, what's going on? I said, I think I'm just stressed. I don't know.
Either turns gray or turns loose.
Yeah, I didn't have a bald spot, but it was just kind of
gives up. This gives up.
Back to you.
Back to me. So Vance, you came to this with a medical device background, but you had been mostly larger enterprise along the way, but looking for sort of startup. Talk a little bit about that, because I think a lot of times people wonder how to make that transition if they've had a successful large enterprise career into early stage.
So my experience will be 180 degrees different from what Spencer just described. And so I was 48 when I met Spencer. I was between jobs. I had just finished being vice president of sales and marketing for a company. And but like you said, I'd been in big, large corporations. I remember the last one the last big one I worked for was Smith & Nephew in Memphis, Tennessee, and there were 2,500 people at our particular campus, right? And that was just one one of 5 divisions of the company type thing. So big corporation, right? And it had been good to me, and I'd been there 10 years, and the future always looked brighter for the next 6 months if I stayed than if I went out. And I kept telling myself I was an entrepreneur, and I was doing entrepreneurial things within this big corporate entity. But looking back, that's not really true. So I think people kid themselves a little bit about that. But I decided I was going to try and take the path that I'd seen a lot of other people do. They would go to work at startups. They would get a successful product, the company would sell, and they would make a lot of money. I thought, I want to be an entrepreneur. I've always wanted to do that. So that's what I'm going to do. And luckily, my wife and I both had saved quite a bit of money by that time. I started my own first business, was the American Joint Replacement Registry that was going to track every hip and knee replacement that was put in the United States. These joint replacement registries exist in other countries, and we didn't have one in the United States, which was pretty shocking. And so it was going to be a not-for-profit, and I was going to pay myself very well as the executive director or something of that nature. And that business failed. That went nowhere. Ultimately, I worked on it for about 6 months. So I want everybody to know, right, that it's not all a rosy path. The American Academy of Orthopedic Surgeons decided to start their own joint replacement registry. So, right, I was out of business pretty quickly. And so then I started consulting, medical device consulting, and I ended up with another startup in Florida called Mako Surgical. And they were making a surgical robot for putting in hip and knee replacements, which was my specialty. So I went there, and that was a very unique startup. It's one of the big success stories that people talk about still today. It gives me street cred to talk about having worked at Mako. I was around employee number 350, but I was the first marketing person at the company. And they had over 150 engineers. So it was a very engineer-driven organization. And I have an undergraduate engineering degree, but I've been in sales and marketing most of my career. And so I came in there, and we had sold 17 robots when I started. And 4 years later, we had sold over 155 robots. And we had gone from 12 million in sales to 120 million in sales. We were also on Series G of our funding round, right? So you don't hear that very often. And Series G was $55 million, if I remember correctly, right? So big, huge funding rounds, lots of employees, still not profitable, even with $120 million in sales, right? So, but this is the dream that a lot of entrepreneurs want to live. And that company sold for a record, I believe, 13 times revenue, and was purchased by Stryker, a Fortune 500 company. And that was in 2013. So here we are 8 years later, and that surgical robot continues to drive their business today. It's become a foundational cornerstone for them and their business. So I've had a startup that didn't work out, had a startup that paid off really, really well, so forth. I came to Fayetteville with a startup and worked for a while, as I said, as vice president of sales and marketing. But I got the startup in my blood. And along that pathway, I realized I want to work where I own a significant portion of the company. I want to be involved in the strategic decision making and so on and so forth. And you get that with a startup, right? And joining early. And so Spencer and I were able to have a meeting in the minds and come together to get this company going. And so it's worked out from there. And now I can't ever go back, right? I can't go back to the big.
You're
entity.
unemployable once you've been on this side. Once you've been on this side of the, it's not that you couldn't get employed. You could, but you hate it, right?
Yeah, I miss the 401k plan.
Yeah.
Right.
My thing was always, when I would take a respite from startups, is I'd go take a job somewhere, and it's a senior level, and one of two things was gonna happen. Either I was going to quit out of the despair that comes from being in a sloth-like, autonomic, incredibly bureaucratic place, or I was going to be fired. And those were only two options. And both happened to me at different times. It's just,
and I think one thing I want to add to that makes it very different than Spencer's experience is that from the get-go in the seed funding round, my wife and I invested $150,000 into Lineus Medical. So not only
you were all in.
Yeah, not only are you working at a startup and so on and so forth, you have $150,000 on the line. And as the company has done future funding rounds, my wife and I have continued to invest, right? So where a lot of people say fail fast, fail early, fail fast, whatever it is, like I've always said to Spencer, there is no failure. There is only success.
Sure.
There's only success. So that's a whole different environment than Spencer and I came to it with. As a couple, investing a lot of money in a startup and putting a lot of your capital on the line.
Absolutely.
So, Vance, you could say you are a startup junkie now.
Yes, that's true.
And for our listeners in Colorado, a joint replacement registry is not what you think it is.
That's right.
Just disclosure.
They're not joints that you typically roll, right? And you don't set them on fire if you're lucky. Yeah.
I'm going to bounce this one off of both of you. One question we always ask, and you know this as a listener of the podcast, is if you had the opportunity to go back in time and visit with your younger self, what sort of advice would you give yourself with the knowledge that you have now?
That's a really good question. I'll start with the thing that's most obvious and sticks out. I'd say in terms of kind of working with the FDA, they give you the ability to do pre-sub meetings. They give you the ability to, and some of it's unofficial, kind of non-binding guidance that they'll give you. But I think going through that process would have been helpful if we would have kind of, because it elongates the timeline. So most startups don't want to do it, right? It takes an extra 3 months at least at times to do that. So a lot of startups opt not to do it, but I think that would have been helpful. And then maybe being more conservative about our initial claims that we were going after. But, at the end of the day, we ended up now with the claims that we really wanted as far as intended use. So, it's hard to say, if would it have been better to have clearance a year and a half sooner, and get it done prior to the pandemic, and be selling would have launching a product during the pandemic been fun? No. So I can't say about that one, but that's the first thing. And I'd say, the other thing would just be kind of a simple rule, kind of the rule of pi. It's going to take 3.14 times longer than you think and cost 3.14 times as much money.
Everything takes longer and costs more.
That is, yeah. Whenever I, mentor other entrepreneurs, I really try to stress this to them. But it's an incredibly hard balance between, managing expectations, showing your investors that you're working quickly and you want to accomplish things in the time frame that your manufacturing vendor gave you a quote that said they would do it in. But, so it's a hard balance, but just maybe we would have, if I would have known it was going to take this much money, I may have thought about the capital strategy a little bit differently. And I don't know if that means, a larger seed round or maybe it's a larger second round, right? But I think just knowing that, would have knowing that it was going to take much longer and cost much more would have been helpful for a young me to know.
So one of the things that was attractive to most investors about the company was we had all accepted pretty low salaries to get going. And Spencer, when he was presenting the business plan to me during the seed funding round, said, "We'll have this cleared in 2 years." And, so as you know, we got cleared in 6 years, right? But that it would happen in 2 years. And I, being older and previous startups, said, okay, it's going to be longer than that. Let's make it maybe 50% longer than that. So maybe it'll take 3 years. And so I accepted a salary that was probably half of my market value. And I didn't have any contingencies built into my employment contract after that. So if it took longer than 3 years, then maybe I should be paid at market value or something at that point in time. So that's just something I learned personally through that experience. And I just got my raise with the Fda clearance finally now after 6 years old. So that's something very practical for people to think long-term about. Maybe it doesn't work out in the time frame that you have and how you need to be compensated over time. So I think that's something very practical to think about. And I think the other thing maybe that I had learned in previous startups, this will be the part you have to cut out, Caleb, because I've drawn a blank. And it's funny because you ask this question every time, and I've thought about it every time you ask it in a podcast. So I always I was like, this is what I would say if Caleb asked me that. I'll stop there.
That's fine. We'll leave that for a follow-up segment. Well, listen, guys, if the listeners, and they really are worldwide, someone might be interested in talking about how to partner, how to get regulatory clearance in other areas for what you're doing. But if they want to get a hold of you, what's the best way for them to find out about the company?
Yeah. So, we just revamped our website. So it's lineusmed.com. That's lineusmed.com. So you can go there. You can check out our products. You can check out our team, kind of our partners. If you want to fill out a contact us page form, those get sent directly to me. So I'll be seeing it if you submit one. I'm keeping a hawkeye watch on all those forms that come in, as you can imagine. But that's probably the best way to get in touch with us. We've got a 1-800 number. If you feel like calling us live, I'll give you a guess at who that goes to, Vance and myself. We're pretty easy to reach, pretty flexible. And, Vance and I are both on LinkedIn, and, we both always try to support, whether it's, nurses that reach out or entrepreneurs that have a med device idea or they're starting a business. And, we try to really, support the entrepreneurial ecosystem and the entrepreneurs within it as much as possible. So definitely, if you have questions about the company, interest in the product, if you're involved with a hospital, maybe you're a nurse or an administrator, or someone that would be interested, we'd love to, connect and see if there's a way to collaborate. But I'd say we're pretty flexible, and we're in this product launch phase, so we want to be talking to as many people as we can right now.
And we'll drop that information in the show notes for those listening. If you're driving, don't go looking for it right now. Be safe.
Yeah.
Thanks for coming on, guys, and congrats again. And it's a huge milestone. So we're eager to see what comes next for both of you guys and Lineus as well.
You bet. Absolutely.
Yeah, thanks for having us. Go Hogs.
We'll be. Thank you for listening to this week's episode of the Startup Junkies Podcast. If you enjoyed what you heard today, please check us out at startupjunkie.org/podcast, where you can like, subscribe, leave us a review, and tune in weekly for more great conversations with entrepreneurs from Arkansas, the U.S., and beyond. This episode is brought to you in part by Wright Lindsay Jennings. The Wright Lindsay Jennings Tech Law Team serves a diverse group of tech-focused startups and established businesses, from corporate formation and investors to intellectual property and employment law. Learn more at WLJ.com.